Hi everyone, I'm Carilion Clinic's Karen McNew here with Carilion Clinic's President and CEO Nancy Howell Agee and Dr. Paul Skolnik, who is our chair of the Department of Medicine and also an infectious disease physician, to talk about some of the questions many of you have regarding COVID-19 preparedness and response. So thanks for being here.
Our pleasure.
We'll get started with, can you describe the extra steps Carilion is taking to keep staff and patients safe regarding extra cleaning and distancing protocols?
We've taken many steps, Karen. Things are very different in our hospital compared to the way they were previously. So it ranges all the way from clearing out beds by not doing non-essential surgeries, limiting outpatient and ambulatory visits just to those that are necessary while we pursue telehealth and telephonic methods to reach out to our patients. There's a bunch of procedures that we follow as we welcome our patients into the hospital in terms of how we cohort patients in different areas of the hospital, how we're using our personal protective equipment to protect our patients. The list really goes on and on. It's a different world, but first and foremost, we have our physicians, nurses, and all employees' safety at heart as we're caring for our patients and keeping them safe as well.
Mm-hmm. And then do we have plans to have specific locations set up to house large numbers of COVID-19 patients if needed?
You know, Karen, I think it's important to know that we set up an incident command center now almost 3 weeks ago, and that we have twice daily huddles, communicate to all of our employees daily, to our management team in the evenings, to our physician group, and we're constantly looking at what's ahead, including surge capacity should it happen. It's probably also important to say, so far in our region we have 6 positive cases, 5 of whom are self-isolating at home. We have 1 positive case in the hospital. But we are planning. We do know that we could fairly easily open up about 60 additional beds. The governor has given us permission to open beds as necessary above our allotted or licensed beds numbers. And we're also looking at then what are the supplies we would need if we were to, it's not just a matter of do you have a bed,
right?
What supplies that you would need for surge capacity, as well as what staffing you would need, and are there different ways that we could staff units. Most likely we would move some of our less ill patients to capacity and then add ICU capacity at a different place. I want to also comment about negative pressure, which is important in infectious disease. So we have a whole region in the emergency department at Roanoke Memorial that's a negative pressure region. In addition to that, we have created, along with the help of Agee Hopkins, some very fantastic work to create negative pressure areas in the hospital.
Thank you. Does Carilion have enough medical supplies, such as personal protective equipment? It is something that we continue to hear about. We have drives going on, people making donations. So how can we answer this question?
We do have enough supplies at the moment, and it is a challenge across the country. As the virus moves across the country, we've really had to scramble to make sure that we have enough equipment to protect our employees, our physicians, our patients, and everyone. Our team here is working really tirelessly and as a team to make sure that we have enough of this equipment. We have all sorts of efforts going on in terms of making sure that if we can reuse equipment, we do so. There are methodologies using UV light and other methods that we can use to help sterilize equipment. We have 2 huge UV robot towers here at Carilion that helps us with that. And it's also important to use the right type of PPE or personal protective equipment for each patient, so we don't burn through the precious supplies, the supplies that we can use to take care of patients with COVID-19. It's just as important not to overprotect ourselves if we don't need that protection in certain settings. So we're working to get those messages out to make sure we manage supplies correctly. And we also tag it to the phase of the illness in our geographic region. So some of the hot spots across the country people will read about them using different types of PPE and strategies for PPE, which are appropriate for that stage of illness and their supply of PPE. That's not the situation here right now. So we can actually use even safer methods here while we have supplies to do that, and while the disease is at its current stage here, which we call the containment phase, as opposed to the mitigation phase. So for the moment, we're good, and we're trying to make sure that if things change in the future, we also have adequate supplies.
You know, it's just been remarkable to see what the work of our materials management team is doing in particular. I was over there yesterday taking a look, and they are gung-ho. They're so excited about how do we give the important people taking care of patients, the frontline folks, what they need. And they're working tirelessly too. And sometimes you forget about the people that are maybe in the background, that are just as much the heroes of this whole epidemic or pandemic as our frontline staff are our superheroes.
Right.
Maybe I could also add, it's really been heartwarming to see the community step up with all sorts of donations. The colleges surrounding us, Virginia Tech and other institutions have made large donations of the kinds of PPE that we need, and other companies around the area. So that's been very, very helpful.
Yeah, it's really hard if you start listing all the companies, but Norfolk Southern just showed up with a truckload of material. Habitat for Humanity, Virginia Tech, Radford University, Roanoke College, and the list goes on. And we are incredibly grateful because this is what we need to protect our staff as well as our patients and the communities that we serve.
It certainly has been nice to see that kind of response, and makes us feel happy to be in Virginia. You know,
That's
this
right.
is kind of what we do.
And in our part of Virginia.
Right, in our part of Virginia. So moving on to our next question, what is the status of the drive-through test site? We've heard people talk about that.
So that's been an important strategy that we've used, mostly to offload our emergency department and our primary care facilities. So we've stood that up. It's been operational for several days now, I think maybe even a week. And it's working well. We have test kits to use there, and people come through. We obtain the tests in a very safe manner. We are using this for those patients who are symptomatic. This is not for people who are asymptomatic. It's by referral from either the ED or our primary care sites. So it's a really mechanism to preserve PPE and to get those tests done in the best setting and in the most appropriate way. We also have increasing access to the tests themselves. Originally, it was just through the Virginia Department of Health. Now there are companies like Quest and LabCorp and Roche that we can utilize. And there's yet a surge to the country. So the issue of enough testing is still there, which is why we have to make sure we test the right people to help us contain the epidemic, or the pandemic is the proper term.
Anything you'd like to add about our drive-through test site, Nancy?
No, I would just echo that this is really for people who have symptoms, not for people who are asymptomatic or who I would just call the worried well, you know, what if? And you are perfectly safe not to get tested. And the worst that can happen is that a lot of people want to come and get tested who don't need to be. We do need to protect those testing kits and the testing processes for those people who are potentially symptomatic.
And then what does Carilion believe is the biggest misconception regarding COVID-19 among the general public? Such an important point for us to touch on.
You know, that's an interesting question, and in some ways a hard question to answer. But I would say that the misconception relates to this invisible foe and what containment means. So when you tell people social distancing is important, they don't really understand what that means, and so there's either fear around can't see this or don't know what I'm doing, or how to social distance. What we would say, and what Dr. Skolnik I'm sure is going to say, is social distancing is the key to containing this virus. It's a wicked virus. It's highly contagious, but there's something we can do. And if we can contain it, then we can slow the spread and get over this critical period.
Exactly correct. I would emphasize that it's difficult because you can't see it. It doesn't make a whole lot of sense because we don't have a lot of cases around here, yet it is in our community. And to prevent the spread of this illness, what we have at the moment is the mechanisms of great hand washing, always, often, disinfecting surfaces, keeping your distance at least 6 feet from the person next to you, and avoiding things that you might normally enjoy but which tend to bring together groups of people. If those are parties or going to restaurants or things like that, obviously there are financial implications to that as well, but now is our chance. We're blessed in this region to have the opportunity to try to contain it before it spreads through these methods of social distancing and good kind of logical infection prevention means.
You know what I hope happens at the end of this, and we will see an end of this social distancing at some point, but is that people will then understand washing hands is really our first line of defense, and we should be doing those kinds of things all the time, not just when there's a pandemic.
Opportunity to develop good habits when it comes to that sort of thing. And I think it might also be important to point out that while we don't have a lot of cases right now, that's where we want it to stay.
Exactly.
We don't want it to get to a point where we're having to play catch up. So everyone doing what is being asked of them is helping with that.
Yeah, the best thing that can happen is that we get past this and we go, well, we didn't really have any cases. Was that worth it? That's the best we can hope for, is that exactly right. We did the right thing and we prevented the spread or contained the spread.
Will Carilion be able to withstand the impact of the pandemic financially if it lasts for several more months? And can it keep up with operations as it is now?
So that's a really good question. This is a financial consideration for us. It's an economic concern, more than a concern for the whole country, perhaps for the whole world, unlike anything perhaps we've seen in history. Having said that, we are good stewards of our patients' money. We always take care to use funds wisely, and we're paying great attention to that right now. We're trying to use our resources wisely, and we think that we're in a reasonably good place going forward. If this lasts for a long time, that could be a different story. But for right now, yes, we are keeping up with operations, and financially we are reasonably safe and secure.
Thank you. Do community hospitals and rural clinics have different challenges facing COVID-19 than other facilities in the system, such as Carilion Roanoke Memorial Hospital?
So some things are similar, some things are different. I think in general, the major policies and procedures that we use to face this challenge are the same. And we have this incident command team that you mentioned that's really for the whole organization. It's not just CRMH. And those policies relate to testing, PPE, patient care, isolation procedures, negative pressure rooms, all the nitty-gritty of how we take care of patients. There are other ways that some of our affiliated hospitals have different challenges, and those relate to things like personnel, staffing, and the community, the surrounding communities, and how they may view this situation now and how we choose to help them do the right things, if you will.
Anything you'd want to add?
No, I guess I would just emphasize that at Roanoke Memorial, which is our tertiary quaternary medical center, we do take care of the sicker of the whole region, and we continue to do that. So we're very busy right now. We have a lot of sick patients, but we have created a region in the hospital specifically for either patients who have COVID-19 or potentially have COVID-19.
This might be a nice time to remind people that our incident command team isn't just for COVID-19. We have a team always ready to act, always practicing, always preparing for anything that might come our way. And so clearly they're doing a wonderful job right now.
Exactly right.
There is a lot of anxiety in our region. People are scared of becoming sick, as well as financial implications of the pandemic. As healthcare professionals, what is the main message you have for them?
So the main message is to social distance, is to follow good health practices such as hand washing, sneezing into your elbow, staying 6 feet apart. Let's contain the virus. But also to get out and get some exercise, so it's perfectly all right to take a walk, to take care of yourself, to take care of others. You know, connect with people. We are social animals and we want to connect with other people. So this is one of those times when, you know, it's okay to use a device to phone up others, especially people who are perhaps frightened, who are older, who are alone. So, you know, let's just take care of our communities like we've been doing.
I have nothing to add to that.
Some great information. Now, this question comes to us: how will we know when the coronavirus pandemic is over?
And I think that's $1 million question that Dr. Skolnik's going to answer.
Can you give us the date and time?
Yeah.
I'm going to write this down.
Right. So really, I'll give you a somewhat technical answer first, and then the implications that are practical. People have seen the curves that we're following, numbers of patients in different areas of the country, how that is increasing exponentially in certain places right now. We've talked about this concept of flattening the curve, slowing that increase so that we can cope and get through the initial wave of this pandemic. That will happen. This virus will eventually start to subside, and we'll know that in relation to this question when those numbers that we're tracking start to come down. This is likely to be, and this is a little bit of speculation, but it's likely to be a seasonal illness, just like influenza. So as we go through into the summer and a little bit after the summer, the numbers will decrease. They probably won't go away, but they'll decrease. And that'll buy us time as we develop vaccines and other mitigating factors that when this cycles back in the future, which it likely will do, we will be much better prepared. We'll have pre-existing immunity from people who have encountered this virus now. We'll have a vaccine available. We'll likely have treatments that we know work. And so when it comes back, as it most probably will, it will no longer be a pandemic. It'll be another seasonal virus that we have to deal with. I keep using the influenza analogy. People don't realize that across the country each year, there are millions of cases of influenza and tens of thousands of deaths. So, and that virus has been around for a long time. This coronavirus is different in that it doesn't change and shift and drift as the influenza virus does. That's why we get seasons of that are particularly severe. This particular virus is unlikely to change in that manner. This is a new coronavirus. SARS and MERS were former ones, but unless there's a new coronavirus that's introduced, we should be much better as time goes on.
Thank you both so much for your time and answering these very important questions, and we certainly hope that you have found this information useful.